we are going to learn about the ICD-10 classification for the diseases of the circulatory system. You will be able to know how they are classified and what are the subcodes and examples. So now let's go into the topic I00 to I02. So what does this ICD code ranges describe? Acute rheumatic fever. So what do you mean by acute rheumatic fever? It is an autoimmune inflammatory reaction that occurs within 2 to 3 weeks after an untreated or poorly treated streptococcal throat infection. So this can affect multiple organs, especially the heart, joints, skin and brain. So what is the physiology of this? The body's immune system mistakenly attacks its own tissues after a streptococcus infection. So this can cause inflammation of the heart, joints, skin and also the nervous system. So I00, that is a rheumatic fever without heart involvement. So this code, it is used when there are joint pains, fever, raised ESR, positive ASO titer but no heart damage. So there are no further subdivisions exist for I00. For example, when a 12-year-old child presents with joint pain, fever, raised ESR and also positive ASO titer. So echocardium shows no heart inflammation. So what do you code here? You have to code I00 category code. So from the right side, you can see the picture of the rheumatic heart disease. So this image shows how rheumatic fever can progress to the rheumatic heart disease involving endocarditis, myocarditis and mitral wall damage. In endocarditis, this inflammation of the heart's inner lining, whereas myocarditis, inflammation of the heart muscle, and mitral wall damage, so thickening and the distortion leading to the valve disease. So this calls the rheumatic fever, and rheumatic fever it progresses to the rheumatic heart disease. So this is about the I00 code. Next, going to I01 code. It is rheumatic fever with the heart involvement. So this includes acute rheumatic carditis, so which may affect the myocardium, that is heart muscle, pericardium, outer heart layer and endocardium, inner heart lining. So what is the subcode of rheumatic fever with heart involvement? I01.0. This is acute rheumatic pericarditis. So this refers to the inflammation of the pericardium. Pericardium is nothing but it is a sac between or surrounding the heart. So what are the symptoms of this acute rheumatic pericarditis? It may be a chest pain, a pericardial friction rub and also the pericardial effusion. So coming to an example, it is a 15-year-old with acute rheumatic fever. It develops a chest pain and also a pericardial friction rub. So what do you code here? I01.0 code. So next coming to I02 rheumatic chorea. So what do you mean by rheumatic chorea? It's a neurological complication of acute rheumatic fever. So this is characterized by involuntary jerky and also uncoordinated movements mostly in the children. So this is caused by the autoimmune effects of the basal ganglia in the brain. So what is the subcode? I02.0. It's a rheumatic chorea with heart involvement. This is used whenever a chorea occurs along with the cardiac symptoms such as murmur, tachycardia means a rapid heart rate, a mitral wall involvement, for example regurgitation. So child with involuntary movements and mitral regurgitation, you have to assign the code I02.0 category. So I01 is nothing but it's a rheumatic fever with heart involvement. I01.0 it is for acute rheumatic pericarditis, and I02 for rheumatic chorea which involves the involuntary jerky movements, and I02.0 for rheumatic chorea with the heart involvement. And next coming to the category codes I05 to I09. This range of ICD-10 it describes about the chronic rheumatic heart diseases. So what are the chronic rheumatic heart diseases? We will see in the detail. So chronic is nothing but this is a long term, right? So these diseases are the long term complications of the previous rheumatic fever. So this leads to the valvular scarring and deformity, which affects the normal heart functioning, normal heart wall function. So I05 code. I05 is nothing but it's a rheumatic mitral valve disease. So what does this rheumatic mitral valve disease do? These conditions, they involve the scarring and deformity of the mitral valve from the early rheumatic fever. So this is mostly caused by the valvular lesion, which is caused by rheumatic fever. For example, I05.0, it is rheumatic mitral stenosis. So what do you mean by rheumatic mitral stenosis? It's a narrowing. Stenosis is nothing but it's a narrowing of the mitral valve. So this impedes the blood flow from the left atrium to left ventricle. So this leads to the dyspnea. Dyspnea is nothing but shortness of the breath and also left atrial enlargement. So what is the classic sign of rheumatic mitral stenosis? The loud opening snap and also the diastolic murmur. For example, if a 45-year-old with loud opening snap echocardium shows mitral stenosis. So how do you code it? You have to assign the code I05.0. And next I05.1, it's a mitral regurgitation. In this, the mitral wall fails to close properly, causing the backflow of the blood into the left atrium during the systole. So what does it produces? It produces a hollow systolic murmur, nothing but it is heard throughout the systole. So whenever a patient with hollow systolic murmur and history of rheumatic fever is diagnosed, so you have to assign the code I05.1. And this is about the I05 code. Coming to I06 code, it describes about the rheumatic aortic valve diseases. I05 mitral valve, I06 aortic valve. So what do you mean? It affects the aortic valve usually due to the leaflet thickening, fusion or deformity from chronic rheumatic inflammation. So what do you mean by it? Aortic stenosis means a narrowing of the aortic wall due to thickened or the fused cups. So this process produces a systolic murmur, and I05 produces a hollow systolic murmur, whereas I06 it produces a systolic murmur. It is often with the radiation to the neck. For example, when the echocardium confirms rheumatic aortic stenosis, you have to assign the code I06.0. Then I07, it's rheumatic tricuspid valve disease. So what do you mean by this? This code describes the long-term complications of the rheumatic fever with involving the heart valves and also the myocardium. So in this rheumatic tricuspid valve, rheumatic involvement of the tricuspid valve takes place. This leads to the right atrial enlargement and also the symptoms of the system venous congestion. So what will be the example of this? It's a tricuspid stenosis which is confirmed by Doppler. So whenever a tricuspid stenosis is diagnosed, you have to assign the code I07.0. And I08 is for multiple valve disease. This is used more than one valve has the rheumatic involvement. It is commonly the mitral plus aortic valves are affected together. So it may present with the features of mitral stenosis and also the aortic regurgitation. So whenever mitral stenosis and aortic regurgitation are diagnosed in the record, so you have to assign the code I08.0. And next coming to I09, what does it describe? It describes about the other rheumatic heart disease. So this is used for the rheumatic complication which is not limited to a single valve. So this includes rheumatic myocarditis and other chronic heart changes due to the rheumatic fever. So in the right side, you can see the picture of the regurgitation and also the stenosis. Here you can see the right atrium or right ventricle. It is the upper chamber, right chamber of the heart that receives the deoxygenated blood from the body, whereas right ventricle, it's the lower right chamber that pumps blood to the lungs through pulmonary artery. And in the right side, you can see the tricuspid valve So this is located between the right atrium and right ventricle. What does this wall do? It ensures the one-way blood flow from right atrium to right ventricle. So these are the tricuspid valve problems. The regurgitation is nothing but it's a leakage, and also stenosis is narrowing. So when the valve doesn't close properly or completely during the systole, what happens? The blood leaks backward, right? The blood leaks backward from the right ventricle, right atrium, instead of moving only towards the lungs. So this causes the right atrial enlargement and can lead to the congestion in the body. So doesn't close completely, blood leaks backward. This is called as tricuspid regurgitation. So then coming to stenosis. In stenosis, the valve doesn't open fully during the diastole, nothing but when the heart relaxes. So this makes it harder to the blood flow from the right atrium to right ventricle. The right atrium, it becomes enlarged due to increased pressure, whereas stenosis, it usually results from the rheumatic scarring that thickens or fuses the valve cusp. So how rheumatic fever causes this? After rheumatic fever, the immune system attacks the heart walls. Okay, over time, this inflammation leads to scarring and deformity of the valve leaflets. So the valve can become thickened, fused, or retracted, resulting in the stenosis and regurgitation. So, for example, TS means tricuspid stenosis. TS confirmed by the Doppler. So Doppler ultrasound, it's a type of echocardiography. It shows the restricted valve opening and the pressure build up in the right atrium. So code it as I0 7.0 for rheumatic tricuspid stenosis. And next, coming to the category codes I10 to I16, that is hypertensive diseases. So these ICD-10 codes include all types of the hypertension, such as primary hypertension, hypertensive heart disease, hypertensive chronic kidney disease, combined heart plus kidney hypertension, secondary hypertension, and also the hypertensive crisis. And at the right side, you can see the picture, the signs and symptoms of the hypertension. So what are they? Fainting, dizziness, low blood pressure, irregular heartbeat, fatigue, nausea, and vomiting. So these are all the symptoms of the increased blood pressure. So essential hypertension, coming to I10 code. What do you mean by essential hypertension? It's a high blood pressure without an identifiable cause. So this is the most common type. So what are the characteristics of I10? The persistent BP range is 140 by 90 mmHg. So there are no signs of heart or kidney disease. There is no subcode. There is only one code, that is I10. You have to assign I10 code for essential hypertension. And next, coming to I11. What it is? Hypertensive heart disease. So what do you mean? High blood pressure that has caused the heart complications such as left ventricular hypertrophy, LVH, heart failure, or angina. So chronic high pressure forces the heart to pump harder, then the thickened heart muscle, that is hypertrophy, and that eventually weakens and it leads to the heart failure. So next, coming to hypertensive heart and kidney diseases, that is I11 to I13. So meaning it's a long-term high blood pressure causes the heart to work harder. So over time, the heart becomes thickened and also weak. What does it do? It leads to the heart failure. So what are the symptoms of the hypertensive heart disease with heart failure? You can see the symptoms like shortness of breath, fatigue, ankle swelling, orthopnea, that is difficulty breathing when lying down. So for example, long-standing hypertension plus left ventricular failure, I11.0. You have to assign the code I11.0 for hypertensive heart disease with heart failure. So next, coming to I12 code, nothing but hypertensive chronic kidney disease. So what is the meaning of this? It's a constant high blood pressure damages the kidney small arteries leading to reduced kidney function. So what are the subcodes of this I12? I12.0, I12.9. So I12.0, it describes the hypertension and also chronic kidney disease stage 3, that is moderate kidney damage. So in I12.9, hypertension plus end stage renal disease, nothing but the sixth stage. The end stage is nothing but there are 5 stages, and the stage next to the fifth stage is the end stage. So what is the mechanism which works over here? High BP, whenever a hypertension is increased, it causes arteriosclerosis of renal arteries, which decreases the filtration, and then it damages the kidney, resulting in the chronic kidney disease. And then coming to the category I13, that is hypertensive heart and kidney disease. So what does it mean? Both the heart and kidneys are damaged due to chronic hypertension. Chronic hypertension, nothing but the long term, the long effect of the hypertension. So why this matters? The two organs are interconnected, right? Heart and kidney are interconnected. So whenever the kidney failure increases, a BP and heart failure reduces. So this results in the kidney perfusion, creating a cycle. So this is about the hypertensive heart and kidney disease. So next we will talk about I15, that is secondary hypertension. So what do you mean by secondary hypertension? So unlike primary hypertension, secondary hypertension is due to an underlying cause. So whenever hypertension is caused by another disease, so it is called as a secondary hypertension. So there are common causes which include this secondary hypertension. They are renal disease, endocrine disorders, pregnancy-related conditions, and tumors such as pheochromocytoma, and also the renal artery stenosis. So the renal artery stenosis, you can see the picture around the right side. This renal artery becomes narrowed by the plaque. You can clearly see in the picture. The kidney, it senses this as a low pressure and it releases the renin, activating the RAS system. RAS is nothing but a renin-angiotensin-aldosterone system. So this leads to the vasoconstriction and sodium retention, increasing the systemic blood pressure. So whenever renal artery stenosis is diagnosed, you have to assign the code I15.0. So next, coming to I16 category, which is hypertensive crisis. So crisis means absence of. So this is a medical emergency with dangerously high blood pressure that can cause the organ damage. So usually BP is, the normal range of BP is 180 by 120, right? So this is the usual normal blood pressure range. So I16, what are the examples? I16.0 for hypertensive urgency, I16.1 for hypertensive emergency. So what are the differences between urgency and emergency? So urgency is nothing but a severe BP elevation, for example 200 by 120 mmHg, without the target organ damage. So this condition is named as the hypertensive urgency. What symptoms you will see over here? Headache, dizziness, and also the anxiety. Whereas coming to hypertensive emergency, so severe BP elevation with organ damage. So in I16.0, within urgency code, you will never see the organ damage. But in hypertensive emergency, there is an organ damage. So for example, chest pain, confusion, renal injury, and also the renal failure. So this is the difference between hypertensive urgency and hypertensive emergency within the hypertensive crisis. And next, I22, I25 category codes which describes the ischemic heart diseases. So what are these diseases? These ICD-10 codes cover heart conditions caused by reduced blood supply. Ischemia is nothing but reduced blood supply to the myocardium due to narrowing or blockage of the coronary arteries. So what does this include? It includes angina pectoris, nothing but chest pain, myocardial infarction, heart attack, and also the chronic ischemic heart disease. So what do you mean by angina pectoris? This occurs when the coronary arteries can't deliver enough oxygen to the heart muscle. So whenever coronary arteries that does not deliver enough oxygen to heart muscle, this angina pectoris, the chest pain occurs, resulting in the angina pectoris. So it's a warning sign of underlying coronary artery disease. So you have subcodes I20.0 unstable angina. So what do you mean by unstable angina? Sudden or worsening chest pain at rest. So this is an emergency that may lead to a heart attack. So at the right side, you can clearly see the picture, angina pectoris at the top and bottom, myocardial infarction. So in angina pectoris, you can see it shows the heart and a partially narrowed coronary artery. Here, the narrowing, the plaque buildup, it reduces the oxygen delivery to the heart muscle. So what does this causes? It causes a chest pain, especially during the exertion or stress. Whereas in myocardial infarction, it shows the same artery completely blocked by a blood clot. Here it is partially formation of the plaque. Here it is completely blocked by a blood clot. So the heart muscle beyond the blockage, it dies, right, due to lack of oxygen. So what happens when a muscle blocked? It doesn't get oxygen. So the heart muscle, it dies. So this is a medical emergency. This is often treated with the therapies like angioplasty, stents, etc. So this is how you code the I20, the angina pectoris, and also the myocardial infarction. And next, coming to the myocardial infarction, I21. So what is acute myocardial infarction? This refers to the first or current episode of the heart attack. So how does it is caused? By a sudden blockage of the coronary artery. So whenever there is a sudden blockage of a coronary artery, cutting off oxygen to the heart muscle. So this includes two. What are they? STEMI and NSTEMI. So I21.0, it is STEMI of anterior wall. So this involves the left anterior descending artery. So this supplies the front part of the heart. For example, ST elevation in the leads V1 to V4, you have to assign the code I21.0. And then next I22, which is a subsequent myocardial infarction. Nothing but it's a new heart attack. Subsequent myocardial infarction is nothing but it's a new heart attack that occurs within the 28 days of the previous heart attack. So it shows the heart muscle is vulnerable after the first MI. So what are the complications following the acute MI? It is I23. So this occur within the 28 days after an MI. Either it may be due to a mechanical problem or the electrical problem. For example, I23.1. So whenever there is a atrial septal rupture after MI, that is nothing but a tear. You can find a tear in the wall between the heart's atria. That is called as the atrial septal rupture. So whenever atrial septal rupture is diagnosed, you have to assign the code I23.1. And at the right side, you can see the picture of the acute coronary syndrome at the top and down the damaged heart muscle. So in the top picture, it shows the progression of the coronary blockage and its clinical forms. So what does it show? Unstable angina, which is a minimal blockage, blood flow is reduced, but there is no muscle death. And it also shows the NSTEMI. This is a partial blockage of the coronary artery. You can clearly see in the picture, it's a partial blockage. And whereas coming to STEMI, it's a complete blockage. You can see a formation of plaque and blood clot over here, the pink colored one, the centered part. So this is the differences between the unstable angina, NSTEMI and STEMI. And coming to the damaged heart muscle picture, it shows the coronary arteries that supply blood to the heart. So when this is blocked, the area beyond the blockage, it becomes ischemic and dies. So the damaged area, it weakens the heart function, leading to the heart failure or the complications. So this is about the acute myocardial infarction and its complications. And next, I24 and I25. These are the I24, it describes the acute ischemic heart disease, and also I25, chronic ischemic heart disease. So I24 is used when there is a reduced blood flow and there is no classical myocardial infarction. there is a reduced blood flow, but you cannot find the heart attack. So it means the heart muscle is not getting enough oxygen temporarily or partially, but cell death has not yet occurred. So the subcode is I24.0. Thrombosis detected on angiography, but no MI. So next, coming to I25, the chronic ischemic heart disease. It refers to the name itself refers to the long term. So it leads to the reduced oxygen supply to the heart for months or years. So it is often linked with the old infractions or the stable angina. Here you can see a clear picture of the ischemic heart disease, where a heart with the narrowed coronary arteries, in the blocked artery, it limits the oxygen delivery to the heart muscle. So the damaged heart muscle, it shows the region suffering from the chronic ischemia or scarring. So you can clearly see the damaged heart muscles over here, the blocked artery. So this is about the classification of few ICD-10 and CM codes for diseases of the circulatory system. And this is for today's session. In the next session, you are going to learn about the continuation of this ICD-10 and CM classification. Thank you.